My name is Greg Nichols. I'm a physician at Goldsboro OB/GYN. Hypertension with pregnancy is a condition that can pose some unique challenges for both the mother, the baby, as well as the physician who's making the diagnosis. Hypertension just refers to the term of an elevated blood pressure. The criteria that we use for determining hypertension is a top number or systolic blood pressure of 140 or higher, and a bottom number or diastolic pressure of 90 or higher. There really are four different disorders of hypertension that we try to look for in the pregnant patient. One is preeclampsia or toxemia of pregnancy, which is what a lot of patients are familiar with that term. The other is gestational hypertension. The third entity is pre-existing hypertension. And then the fourth entity is pre-existing hypertension with superimposed preeclampsia. Preeclampsia basically is an indication of high blood pressure and protein in the urine. Usually it's seen after 20 weeks of pregnancy. It has some significant risk for the mom and for the baby. In terms of the risk to the baby, the main risk would be growth restriction, or what's called intrauterine growth restriction. That's called IUGR. That just means that the placenta, which is the lifeline to the baby, where the oxygen is coming through, is reduced. In terms of risk for the mom from preeclampsia, again, if it's mild, usually you're not going to have a lot of multi-organ system involvement, but if it gets to a severe stage, you can have neurologic involvement, seizures, a stroke, or you can get liver failure. We certainly would advocate attempts to try to maintain a healthy lifestyle, to be conscientious about what your diet is, to try to keep your weight basically try to keep your weight in a normal range. Also, the importance of staying active during the pregnancy and exercising throughout the course of the pregnancy. In addition, we certainly would recommend behaviors such as smoking to be limited or essentially to be cut out. I know it's difficult for a lot of people that are long-term smokers to cut out completely, but certainly cutting back can have some significant impact in terms of the health for the mom, but also for the health of the baby.